the first virtual EHA. I think it is really, really important that we're having this Congress and using all these exciting virtual platforms, because it's a way for us to continue to exchange information and present data. And it will also provide a bit more of a more permanent footprint for EHA and allows people to dip in and out of the Congress. So probably there'll be more attendees, I'd say. So we're presenting a number of abstracts at this meeting. The first one, probably for discussion, is second line in myelofibrosis, which, as you know, remains an area of unmet need. So we know that Ruxolitinib is a very potent therapy for myelofibrosis, has significant benefits for patients, but ultimately many patients will lose their response or develop a breakthrough issue. So Navitoclax is of interest in these patients because of its effect on the BCL pathway, and using in cell line data and in primary MPN cells does look to be able to augment Ruxolitinib. An obvious concern, however, would be thrombocytopenia as a common toxicity of these agents. So we are presenting at EHA this year an update of our study, which is an AbbVie study looking at the combination of Navitoclax with Ruxolitinib second line for patients. And the way that the Navitoclax was used in our study was to titrate up in each individual patient. So this is presented as a poster, so you'll be able to take a look at this online. Essentially, we saw really exciting efficacy for this combination and good tolerability. So we didn't find that thrombocytopenia was a major issue. We saw good, nice deep spleen responses in this patient population where the spleen was still persistently present and often at least at baseline, if not bigger, after Ruxolitinib. So just adding on to Ruxolitinib, not withdrawing, we saw significant spleen and symptom responses, but we also are presenting in this abstract some interesting data with regard to biological responses. In my patients, what we've seen for some of them is reduction in bone marrow fibrosis, early days, and we need to see something more consistent, but also some nice inflammatory cytokine responses. And other features for me which are of note and important would be, for example, normalization of serum LDH. So I think this is really interesting, and this data is going to be taken forward in an expanded study where we look at the activity of Navitoclax alone, Navitoclax in combination with Ruxolitinib as a second-line agent, and there will also be an upfront study of the combination of Navitoclax with Ruxolitinib, which will be starting later this year, hopefully if the global health situation improves. And I think this data is really, really exciting and will help us hopefully to address an area of unmet need for patients.